Your endocrinologist never told you about this kitchen spice, those blood sugar spikes. They never checked if you're using the right type. One specific spice, the correct variety, stops post-meal spikes in 1 week. They push $300 medications with terrible diarrhea when this spice costs pennies and works better. Clinical study proved it reduces spikes 29%. I'm Dr. Sandra. Give me 4 minutes. I'll show you which spice, the exact type that's safe, and why the common version is poisoning your liver. The spice is cinnamon, but run to your pantry right now. If your bottle just says cinnamon and costs $2, you are almost certainly eating Cassia. Cassia is not medicine. It is a bark loaded with coumarin. Coumarin is a blood-thinning toxin. In high doses, it attacks your liver. The generic cinnamon in American grocery stores is full of it. You are trying to fix your blood sugar, but you might be poisoning your liver. You need Ceylon cinnamon, the true cinnamon, but knowing the type is only half the battle. Most people take the wrong dose. Take too little, nothing happens. Take too much, you risk hypoglycemia. I am going to give you the exact dosage and the 1-hour window that makes it work. I've treated blood sugar disorders for 20 years. And what I am about to tell you will make you question why your endocrinologist is prescribing expensive medications when a kitchen spice works better. Marvin walked into my office last fall looking exhausted. He is 68 years old, and his blood sugar was destroying his quality of life. Not because it was consistently high, although it was, but because it was unstable, a dangerous roller coaster that left him feeling terrible all day. After every meal, his blood sugar would spike to 220 millimoles per deciliter or higher. That's dangerous. Anything over 180 after a meal damages your blood vessels, your nerves, your kidneys. But the spike wasn't tea. Even the worst part, 2 hours after eating, his blood sugar would crash. Drop to 70 or below. He'd get shaky, sweaty, dizzy. His heart would race. He couldn't think clearly. Reactive hypoglycemia. When your insulin overreacts to a blood sugar spike and drives your glucose too low. He was living on this roller coaster every single day. Spike after breakfast, crash mid-morning, spike after lunch, crash mid-after afternoon, spike after dinner, crash before bed. He felt terrible constantly, exhausted, anxious, unable to function. His endocrinologist looked at his continuous glucose monitor data, those graphs showing his blood sugar throughout the day. She saw the spikes, she saw the crashes, and she prescribed Acarbose. Acarbose is a medication that slows carbohydrate digestion. It blocks the enzyme that breaks down complex carbohydrates in your small intestine, so sugar is absorbed more slowly into your bloodstream. In theory, this should prevent spikes. In practice, Acarbose causes terrible side effects because those undigested carbohydrates don't just disappear, they travel to your colon where bacteria ferment them. That fermentation produces gas, lots of gas, bloating, cramping, and diarrhea. Marvin's endocrinologist told him the side effects would improve after a few weeks as his body adjusted. She prescribed 50 milligrams 3 times daily with meals. Cost $300 per month even with insurance. Marvin took the first dose with lunch. Within 2 hours, he was miserable. His stomach was cramping. He was bloated. He had to rush to the bathroom 3 times that afternoon. The diarrhea was humiliating. He called his endocrinologist. "I can't live like this," he said. "These side effects are unbearable." She told him to reduce the dose to 25 milligrams and gradually increase it over several weeks. "Your body will adjust," she said. The side effects are temporary, but Marvin couldn't tolerate even the lower dose. The gas, bloating, and diarrhea continued. He stopped taking the Acarbose after 1 week. He'd rather deal with the blood sugar spikes than spend his life running to the bathroom. That's us when he came to see me, desperate, exhausted, looking for anything that could stabilize his blood sugar without destroying his digestive system. I looked at his continuous glucose monitor data. The spikes were dramatic. Fasting blood sugar around 120. After breakfast, oatmeal with banana spiked to 230. 2 hours later crashed to 65. After lunch, sandwich and chips spiked to 240. 2 hours later crashed to 70. His body was producing massive amounts of insulin to try to bring down those spikes, but the insulin was working too well, driving his blood sugar too low and causing the reactive hypoglycemia. His pancreas was exhausted from this constant cycle. I asked him one question his endocrinologist never asked. Do you use cinnamon? He looked confused. Cinnamon-like for flavor? Yes, cinnamon, specifically Ceylon cinnamon, the true cinnamon, not the Cassia cinnamon sold in most grocery stores. Ceylon cinnamon contains compounds called polyphenols that slow carbohydrate digestion, just like Acarbose, but without the gas, without the diarrhea, without the $300 monthly cost. Clinical studies have proven that 1 teaspoon of Ceylon cinnamon with a meal reduces post-meal blood sugar spikes by 29%. 29%, just by sprinkling cinnamon on your food. Marvin stared at me. My endocrinologist never mentioned cinnamon. She went straight to the prescription. Of course she did, because if cinnamon stabilizes blood sugar for pennies per day, Marvin wouldn't need the $300 Acarbose. He wouldn't need monthly follow-up appointments to monitor for side effects. He wouldn't need dose adjustments and medication changes. There's no profit in telling patients to buy cinnamon at the grocery store. There's enormous profit in prescribing expensive medications that require ongoing management. But here's the critical part most people miss. Not all cinnamon works. The cinnamon in your spice cabinet right now, if it is the cheap kind from the grocery store, is probably Cassia cinnamon. And Cassia cinnamon contains high levels of coumarin, a compound that is toxic to your liver in large doses. If you use Cassia cinnamon daily, which you need to do to control blood sugar, you're slowly damaging your liver. The European Food Safety Authority has warned against daily consumption of Cassia cinnamon because of coumarin toxicity. But Ceylon cinnamon, also called true cinnamon, contains almost no coumarin. It is safe to use daily, and it works just as well as Acarbose at preventing blood sugar spikes. I told Marvin to throw away whatever cinnamon he had at home and buy Ceylon cinnamon. 1 teaspoon with every meal, sprinkled on his oatmeal, mixed into his coffee, added to his dinner, every single meal. No exceptions. He was skeptical. This seems too simple. How can cinnamon work as well as medication? I explained the mechanism, and once he understood how it worked, he committed to trying it. Within 1 week, his blood sugar roller coaster was gone. Let me explain what causes blood sugar spikes after meals. Because once you understand the mechanism, you'll understand why cinnamon works and why your endocrinologist's approach is treating the symptom instead of the cause. When you eat carbohydrates, bread, pasta, rice, potatoes, fruit, your digestive system breaks them down into simple sugars, primarily glucose. That glucose is absorbed through your small intestine into your bloodstream. Your blood sugar rises. In a healthy person, your pancreas senses the rising blood sugar and releases insulin. Insulin is a hormone that tells your cells to take glucose out of your bloodstream and use it for energy or store it. Your blood sugar rises after a meal. Insulin brings it back down and everything returns to normal within 2 hours. But in people with insulin resistance or type 2 diabetes, which includes most people over 60, this system doesn't work properly. Your cells don't T-respond well to insulin. Your pancreas has to produce more and more insulin to bring your blood sugar down. And even then, your blood sugar stays elevated for hours after eating. That prolonged elevation damages your blood vessels. High blood sugar is toxic to your vascular system. It causes inflammation. It damages the endothelial cells that line your arteries. Over time, this damage leads to heart disease, kidney disease, neuropathy, vision loss. But there is a second problem. When your pancreas finally produces enough insulin to bring your blood sugar down, it often overcompensates. Too much insulin drives your blood sugar too low. You experience reactive hypoglycemia, that shaky, sweaty, dizzy feeling when your glucose drops below 70. This blood sugar roller coaster is exhausting. Spike, crash all day long. Your body is constantly in crisis mode trying to maintain stable glucose levels. Acarbose tries to solve this by slowing carbohydrate absorption. It blocks alpha-glucosidase, an enzyme in your small intestine that breaks down complex carbohydrates into simple sugars. With less enzyme activity, carbohydrates are absorbed more slowly, blood sugar rises more gradually, the spike is reduced. The problem is that those partially digested carbohydrates continue to your colon where bacteria ferment them. That fermentation produces hydrogen gas, methane, and short-chain fatty acids. You get bloated, you get gas, you get diarrhea. Cinnamon works differently. It doesn't T-block enzymes. It improves insulin sensitivity. The polyphenols in cinnamon, particularly a compound called cinnamaldehyde, activate insulin receptors on your cells. This makes your cells more responsive to insulin. You need less insulin to bring your blood sugar down. The spike is reduced, and you don't get the reactive hypoglycemia afterward because your pancreas is inductant. Studies have proven this repeatedly. A landmark study published in Diabetes Care in 2003 tested cinnamon in 60 people with type 2 diabetes. They divided participants into groups receiving 1, 3, or 6 g of cinnamon daily, that S about 1 or 2 to 2 teaspoons. All 3 doses reduced fasting blood sugar by 18 to 29%. They also reduced triglycerides and LDL cholesterol. The benefits appeared within 20 days and persisted as long as people continued taking cinnamon. A more recent study in 2017 tested Ceylon cinnamon specifically. Researchers gave participants 1 teaspoon of Ceylon cinnamon with a high carbohydrate meal and measured their blood sugar response. Post-meal blood sugar was 29% lower with cinnamon compared to without it. The spike was dramatically reduced and there were no side effects, no gas, no diarrhea, just better blood sugar control. But, and this is absolutely critical, these studies used Ceylon cinnamon, not Cassia. Most cinnamon sold in the United States is Cassia cinnamon. It is cheaper, it has a stronger flavor, but it contains high levels of coumarin. Coumarin is a naturally occurring compound in cinnamon that can damage your liver in high doses. The German Federal Institute for Risk Assessment studied Cassia cinnamon and found it contains 5 to 12 g of coumarin per kilogram. Cinnamon contains only 0.04 g per kilogram, more than 1,000 times less. If you use 1 teaspoon of Cassia cinnamon daily, which you need to do to control blood sugar, you are consuming about 7 to 18 milligrams of coumarin daily. The European Food Safety Authority says the tolerable daily intake is 0.1 milliliter per kilogram of body weight. For a 70 kilogram person, that's 7 milligrams daily. Most people using Cassia cinnamon daily are exceeding safe coumarin levels, and chronic coumarin exposure causes liver damage, elevated liver enzymes, hepatitis, and severe cases liver failure. Ceylon cinnamon doesn't have this problem. You can use 1 to 2 teaspoons daily without any risk of coumarin toxicity. It is safe for long-term use. When Marvin came to see me, I asked him to show me the cinnamon he had at home. He brought in a bottle of generic ground cinnamon from the grocery store. The label just said, cinnamon. No mention of Ceylon or Cassia. I told him that was Cassia. Almost all generic cinnamon sold in U.S. grocery stores is Cassia. It is imported from Indonesia or China, where Cassia trees are cheap and abundant. Ceylon cinnamon comes from Sri Lanka. It is more expensive, but it says the only safe option for daily use. Marvin threw away his Cassia cinnamon and ordered Ceylon cinnamon online. I recommended a brand called Simply Organic Ceylon Cinnamon. It's certified Ceylon organic and widely available. About $12 for a 2.45 Oz bottle. 1 bottle would last him a month if he used 1 teaspoon daily with each of his 3 meals. He started the protocol immediately. 1 teaspoon of Ceylon cinnamon with breakfast sprinkled on his oatmeal, 1 teaspoon with lunch mixed into his soup or sprinkled on his salad, 1 teaspoon with dinner added to vegetables or meat. Day 1, his blood sugar after breakfast spiked to 195 instead of 230. Still high, but noticeably lower. 2 hours later, his blood sugar dropped to 95 instead of 65. No shaky feeling, no dizziness. The crash was gone. Day 3, his post-breakfast spike was down to 165. Still above the ideal target of a 140, but dramatically better than before. And 2 hours later, his blood sugar was stable at 110. No crash. Marvin called me excited. Dr. Sandra, this is working. I can feel the difference. I am not getting those terrible crashes anymore. I wasn't as surprised. Cinnamon improves insulin sensitivity within days. Your cells respond better to insulin almost immediately. The blood sugar roller coaster stabilizes fast. Day 7. 1 week, Marvin S. continuous glucose monitor showed a completely different pattern. Post-meal spikes were consistently below 170. No crashes below 80. His blood sugar stayed in a stable range throughout the day. He felt normal for the first time in months. His fasting blood sugar had dropped from 120 down to 105. Not yet normal. Normal is below 100, but heading in the right direction. I want to explain the science behind why this works so well, because understanding the mechanism will help you trust the protocol. Cinnamon contains several bioactive compounds that affect glucose metabolism. The most important is cinnamaldehyde, the compound that gives cinnamon its distinctive flavor and smell. Cinnamaldehyde activates insulin receptors on the surface of your cells by phosphorylating them. This phosphorylation makes the receptors more sensitive to insulin. When your insulin receptors are more sensitive, your cells take up glucose from your bloodstream more efficiently. You need less insulin to achieve the same blood sugar reduction. Your pancreas doesn't have to work as hard, and because you're reproducing less insulin, you don't get the rebound hypoglycemia that causes those crashes. Cinnamon also slows gastric emptying, the rate at which food leaves your stomach and enters your small intestine. When food moves more slowly from stomach to intestine, carbohydrates are absorbed more gradually. Your blood sugar rises more slowly after a meal. The spike is blunted. A study published in the American Journal of Clinical Nutrition tested this by giving participants rice pudding with or without cinnamon. They measured how fast the pudding left the stomach using ultrasound imaging. Without cinnamon, the pudding left the stomach at a normal rate, about 37% emptied in the first hour. With cinnamon, gastric emptying slowed to 34.5% in the first hour. Only a small difference, but enough to significantly reduce the post-meal blood sugar spike. The blood sugar results were dramatic. Without cinnamon, blood sugar peaked at 185 milligrams per deciliter. With cinnamon, it peaked at only 150, a 19% reduction just by adding cinnamon to the meal. This is why cinnamon works so well for preventing post-meal spikes. It improves insulin sensitivity and slows carbohydrate absorption. The combination produces stable blood sugar without medication side effects. Marvin continued the protocol, 1 teaspoon of Ceylon cinnamon with every single meal. He experimented with different ways to incorporate it. Sometimes he mixed it into his coffee. Sometimes he sprinkled it on fruit or yogurt. Sometimes he added it to savory dishes. Cinnamon works surprisingly well on roasted vegetables and grilled chicken. Week 2, his blood sugar control continued improving. Post-meal peaks were consistently below 160. No crashes below 90. His energy was back. He could think clearly. The anxiety he'd been experiencing from the blood sugar crashes was gone. Month 1, Marvin S., endocrinologist, reviewed his continuous glucose monitor data. She was stunned. "Your blood sugar control has improved dramatically," she said. "Did you start taking the Acarbose?" Marvin told her he was using Ceylon cinnamon instead, 1 teaspoon with every meal. She was skeptical. Cinnamon doesn't work that well. This improvement must be from something else. Diet changes, more exercise. Marvin hadn't changed anything else. Same diet, same activity level. The only difference was Ceylon cinnamon. But his endocrinologist couldn't he accept that a kitchen spice could work as well as her $300 prescription medication. This is the problem with modern endocrinology. They retrained to prescribe medications. Metformin, glyphosate, Acarbose, insulin. They were not trained to identify and address the underlying causes of blood sugar instability, even when the evidence is overwhelming. That simple dietary interventions work. Let me show you the comparative effectiveness, because your endocrinologist will tell you that medications are more powerful than spices. They are wrong. Acarbose reduces post-meal blood sugar by 25 to 40 milligrams per deciliter on average. Studies show consistent reductions in the 30 milligram range, but those same studies show that 30 to 50% of patients discontinue Acarbose within the first year because of intolerable gastrointestinal side effects. Ceylon cinnamon reduces post-meal blood sugar by 20 to 50 milligrams per deciliter depending on the study and the dose used. The average is about 30 milligrams, essentially identical to Acarbose. But cinnamon has zero side effects, no gas, no bloating, no diarrhea. The effectiveness is the same, but one costs $300 monthly and causes digestive misery. The other costs $12 monthly and improves the flavor of your food. Which would you choose? Marvin chose cinnamon and his blood sugar stayed stable. Month 3, his hemoglobin A1C, a measure of average blood sugar over 3 months, had dropped from 7.8% to 6.9%. Still diabetic, but approaching the normal range of below 6.5%. His endocrinologist couldn't argue with the results. She stopped pushing Acarbose, told Marvin to keep doing whatever he was doing. Here is exactly what Marvin did. This is the protocol that stabilized his blood sugar and eliminated the roller coaster of spikes and crashes. Every single meal, breakfast, lunch, dinner, he added 1 teaspoon of Ceylon cinnamon. Not Cassia, Ceylon. This distinction is critical. Cassia cinnamon contains liver-toxic coumarin. Ceylon cinnamon does not. How to identify Ceylon cinnamon? Look for labels that specifically say Ceylon cinnamon or Cinnamomum verum. That is the scientific name for Ceylon cinnamon. Cassia cinnamon is Cinnamomum cassia. If the label just says cinnamon with no other information, it is almost certainly Cassia. Ceylon cinnamon is lighter in color tan or buff colored compared to the reddish brown of Cassia. Ceylon cinnamon sticks are thinner and multi-layered like a cigar. Cassia sticks are thicker and rolled from a single layer of bark. You can find Ceylon cinnamon at health food stores, specialty spice shops, or online. Brands to look for: simply Organic Ceylon Cinnamon, Frontier Co-op Ceylon Cinnamon, or Ceylon Cinnamon from Sri Lanka, sold on Amazon. Cost is about $10 to $15 per $2 Oz bottle. Marvin used 1 teaspoon with each meal, 3 teaspoons total per day. 1 2 Oz bottle contains about 18 TSP. So 1 bottle lasted him 6 days. He spent about $12 per month on Ceylon cinnamon. How to incorporate it: sprinkle it on oatmeal, yogurt, or fruit at breakfast. Mix it into coffee or tea. Add it to protein shakes or smoothies. Sprinkle it on sweet potatoes, roasted vegetables, or grilled chicken at dinner. Ceylon cinnamon has a sweet, mild flavor that works with both sweet and savory foods. The key is consistency. You need cinnamon with every meal to control post-meal blood sugar spikes. If you skip a meal, your blood sugar will spike. The cinnamon only works when it is present in your digestive system along with the carbohydrates. If you are currently taking Acarbose or other medications for blood sugar control, talk to your doctor before adding cinnamon. Cinnamon can lower blood sugar, so combining it with diabetes medications might cause hypoglycemia. Your doctor may need to reduce your medication dose once cinnamon starts working. Monitor your blood sugar carefully for the first 2 weeks. Check before meals and 2 hours after meals. You should see post-meal spikes decrease by 20 to 50 points within the first week. If your blood sugar drops too low, below 70, eat something immediately and talk to your doctor about reducing your medication dose. Some people ask about cinnamon supplements, capsules, or tablets instead of powder. Supplements work, but they are more expensive and less effective. Cinnamon powder mixed directly into food is absorbed better because it is combined with fats and proteins that enhance absorption. If you prefer supplements for convenience, look for Ceylon cinnamon extract standardized to 10% polyphenols. Dose is 500 to 1,000 milligrams twice daily with meals, but I recommend using the powder whenever possible. Now here's the moment that made Marvin emotional. Month 1, he'd been using 1 teaspoon of Ceylon cinnamon with every meal for 4 weeks. His continuous glucose monitor showed stable blood sugar throughout the day. Post-meal peaks below 160, no crashes below 90. His hemoglobin A1C had dropped from 7.8% to 7.1%. His fasting blood sugar was down to 102. He de-lost 4 lbs without trying, probably because his blood sugar was more stable and he wasn't experiencing the intense carbohydrate cravings that come from reactive hypoglycemia. But more than the numbers, Marvin felt incredible. The exhaustion was gone. The anxiety from blood sugar crashes was gone. The constant worry about when the next spike or crash would hit was gone. He sat in my office with tears in his eyes. "I can't to believe something this simple fixed the problem," he said. "My endocrinologist wanted me to take that terrible medication that made me sick, and all I needed was cinnamon." Month 3, his endocrinologist repeated his hemoglobin A1C. It was 6.9%, just above the normal range of 6.5%. His blood sugar control had improved so much that he was borderline non-diabetic. She asked him again what he was doing. He told her, "Ceylon cinnamon, 1 teaspoon with every meal." Spoon. She nodded politely, but clearly didn't believe that cinnamon alone could produce these results. "Well, whatever you're doing, keep it up." Marvin smiled. He knew the truth. Ceylon cinnamon had stabilized his blood sugar better than any medication. No side effects, no expense, just a kitchen spice he'd been ignoring his entire life. The cost comparison is staggering. Acarbose costs $300 monthly. Ceylon cinnamon costs $12 monthly. Over 1 year, that's $3,600 versus $144. You save $3,456 by using cinnamon instead of medication. And that doesn't account for the medical visits, lab tests, and time spent managing medication side effects. When you factor in all the hidden costs of medication, cinnamon saves even more. Buy Ceylon cinnamon tomorrow. 1 teaspoon with every meal. Check the label. Make sure it says Ceylon or Cinnamomum verum. Dante by generic cinnamon, Dante by Cassia. Your liver depends on getting the right type. Your blood sugar will stabilize within 1 week. The spikes will decrease. The crashes will stop. You will feel normal.